Hello, YouTubers. Welcome to my channel, Lady Nephrology, where we talk all things nephrology. But today we're going to veer off a little bit from nephrology, and we're going to be talking about telehealth nursing. Because since COVID, I never thought as a nurse practitioner that I would be able to work from home, but this is like the new era, a wave of healthcare right now. And so we're going to be talking to Miss Fabulous, Catherine Ebune, and she's going to be giving us some insight about telehealth nursing. I'm going to go ahead and introduce her. Catherine Ebune, she is a nurse for 28 years. 11 of those years as a nurse practitioner. And as a nurse, she worked on the cardiac unit, the step-down ICU, and the GI and liver units. And as a nurse practitioner, she's worked primarily in internal medicine, correctional health, and geriatrics. And currently, she is my co-worker. We work together and we're working in nephrology. And she also is a clinical assistant professor at the University of Texas in Arlington. She is currently pursuing her Doctor of Nursing practice with a projected graduation date in December of 2022. So let's welcome this fabulous Catherine Ebune to Lady Nephrology. How are you doing today?
I'm doing great, Kenda. Thanks so much for inviting me. It's good to see you outside of work also.
I know, good to see you as well. And thank you so much for your time and coming to give us some insight, okay? So I'm gonna go ahead and start with the questions. So the first question I have is, what is the definition of telehealth? What is telehealth nursing?
That's a great question, Kenda. Thanks for asking that. Especially, as nurses and also as providers, I think that sometimes there's a little bit of confusion because a lot of times telemedicine is used interchangeably with telehealth, but telehealth actually embodies all of telemedicine as well. Now, we can describe telehealth in terms of 4 methods. The first method is synchronous type of telehealth, and what that is the delivery of healthcare using secure real-time video, where the patient and the provider can see each other and engage in conversation. That's the synchronous method of telehealth. The asynchronous method is what sometimes, as providers, we will use for consultation. So let's say, for example, you take a picture of a wound, you're not sure exactly what to do about it, and you send that photograph to a wound specialist. They review that and you consult with each other and you're able to come up, with a treatment strategy for that patient. So that's asynchronous. We also have remote patient monitoring, which a lot of people have used in the past, but of course, we just didn't look at it as telehealth. For example, heart monitoring, 24-hour heart monitoring, also blood pressure, monitoring remotely, as well as weight monitoring, remotely. So that's a remote way of, monitoring, patient via telehealth. And then there's also mobile health, which is usually abbreviated mHealth. mHealth is getting popularity. This is a way that providers can send text messages to their patients to remind them, hey, take your medication. So it helps to improve things like medication adherence, blood pressure, taking, adherence, and also reminding them about, patient visit. So in a nutshell, that's what telehealth is all about. Isn't that exciting?
Yes, definitely. So how long has it existed? Is this something new, or is it something that's been years and years ago?
That's also a great question, Kenda, because, until recently, most people were not aware that telehealth has really been around. And, in my digging, I found out that the first documented telehealth was back in 1879. Imagine that. Yes.
Oh my God.
And how did that come about? It came about, for a doctor, who decreased unnecessary office visits just using telephone calls. And this was documented by the Institute of Medicine in the year 2012 that this actually occurred. Now, fast forward, it took another 100 years before NASA now started coming up with creative ways, of coming up, with telecommunications, and telemedicine to help astronauts who are in space, and also commercial, airline, flight persons, who have problems, in terms of, medical health. Now, it's all full blown. Yes.
Yes.
With COVID. Yes.
So how do you feel about the role of nurse practitioners expanding in telehealth?
I think it is really outstanding. This is a time, for nurse practitioners to just glow. One thing about, telehealth is constantly evolving. And we as nurses are always evolving with things that are happening, in health. So I believe as telehealth evolves, the APRN role will continue to evolve and complement telehealth, and it's going to lead to improved patient outcomes and increase patient satisfaction. Why? Because APRNs, when we get involved in telehealth, we're able to reach patients everywhere in the world. Persons in rural area, persons in urban area, persons that are vulnerable, persons that are isolated, persons that are disabled. We're able to expand our horizon. So there's great things that are going to happen for APRNs in the future. And so this is really an exciting time.
Yes, definitely. So what do you see are some advantages of telehealth?
Oh, wow, there are so many advantages of telehealth. Where do I begin? First, let me just start out, with what COVID brought out. So when COVID came out, the first thing that everybody was thinking was safety, social distancing, what will providers do to be able to triage their patients, from a remote, distance and still be able to take care of them, appropriately. So that's the very first thing, is the fact that, it brought safety, into focus. Public health was concerned about widespread, infection rate for COVID, patients, and then also non-COVID patients. So telehealth was really on time at this time. Also, one of the Healthy People 2020 mandate, which prescribes that all people should be able to conveniently obtain health services for emergency care, primary care, and mental health, is actually fulfilled by telehealth, because telehealth is able to reach all of those horizons. It is convenient, it is timely for both the provider as well as patient. Usually when a time is set, the patient appears on the video, and the provider is also on the video at the right time. There's no waiting lines in the clinic area. It is cost effective directly in terms that, it saves transportation costs to the patient, also to the provider who has to drive from their home to the clinic. And if they can work from the privacy of their home, it makes that very convenient. Indirectly, it's been shown to decrease emergency room visits and also hospital admissions. The good thing also is the fact that it's currently being reimbursed at the same rate as in-person visit due to the current COVID pandemic waiver 1135 at Congress when COVID broke out.
Oh, amazing.
Yes, there's also decreased missed patient appointments, because patients don't have to worry about weather situations, they don't have to worry about transport. They're able to turn on their smartphone, and they're able to visit with their physician. It's also efficient. Physicians and providers and nurse practitioners are able to serve more patients and diagnose quickly and treat quickly as well.
All right. Yeah, that was one of the other questions I was about to ask you about, that this is being reimbursed, but you already answered that question there.
Yeah, well, we'll get to it again to kind of expand a little bit, on that.
So what do you see as some of the challenges?
As with everything, there are always going to be challenges. For APRNs and other providers, one of our biggest challenges actually is the physical exam and how limited it is. We're used to, being able to put our stethoscope, to touch. We're able to, touch and feel the texture of, what's going on a person's skin, and be able to truly visualize, other things that are going on, with the patient. So sometimes that can be really limiting. Another major limiting factor is the fact that sometimes some providers may be in a place where they don't have broadband, there's no internet. They may not also have a good video platform in the places, where they work, especially, for providers that have their own practice, because those are some things that may be quite expensive. Sometimes there are technical problems when you're trying to log in, with a patient to be able to assess them. And there are also security breaches, like privacy, issues. We're always concerned about HIPAA, which is very important in terms of confidentiality for the patient. There are also regulatory and industry barriers that vary from state to state, and that sometimes can be very confusing for the clinician, for the provider, for the APRNs. So we have to familiarize ourselves with each of the states that we are licensed to practice to find out what are their, rules and regulations in terms of telehealth, and be able to make sure that, we're adhering, to those. For the patient, so most of that I just said was basically, for the provider. In terms of the patient, again, broadband internet, lack of technical skills may be a problem, for the patient. For some of them, it may be financial. They're not able to afford a smartphone. They may not have a computer. They may not have a tablet. Also, some of them have the perception that, telehealth may not be of such high quality, but actually studies have shown that telehealth is almost in comparison of high quality as an in-person, visit. Privacy issues are always a big concern also, for patients. And then also, recently I was just reading that there's a lack of deaf and hearing impaired services for persons that have trouble hearing. So we don't have that in place, yet. And I've had situations where I've had patients that have difficulty hearing, and we have to move it in such a way that another family member has to be present. Lack of interpreters for non-English speaking. A lot of times there's Spanish speaking, there's Vietnamese, but sometimes it is difficult to get, another person, to actually on board in the video setting to be able to help to do the interpretation. So those are some challenges that I do see, for telehealth at this time.
Definitely. And you actually answered the next question. What are some improvements? And that kind of is in the same realm as what are some improvements. So do you have anything else to add about improvements for telehealth?
One of the things that I can add, in terms of APRNs is the fact that it will be really nice if there's a standardization of APRN requirements for all states, especially when it comes to telehealth. Now that, the wings are all spread out, there's multi-state licensing, we're able to practice across states. It would be nice to just have everything standardized so that there's not that much confusion for APRNs as we practice, from state to state, or having to keep up with nurse practice acts from one state, to another. Also, the standardization of telehealth encounter care guidelines. As we know, most disease processes, most equipment that is used, there's always guidelines that guides the profession as to how to use it the right way, so we avoid legal pitfalls and things like that, malpractice.
Any advice that you would give to nurse practitioners who are new to telehealth?
Oh, absolutely. One of the things that I was really thinking about is for persons that maybe they've not been nurse practitioners yet, that a consideration for most schools right now will be to include that in their curriculum, to be able to teach students now about telehealth and engage them in a clinical setting so that they understand the legal aspect of it, how the equipment works, what it means to the provider, what it means to the patient. To be able to cover all those dynamics, I think will be real important. But in terms of, advice, to the NP who is new to telehealth, if possible, if they have not had a basic training, like in the CEU course, to enroll in something like that, to be able to understand and get to understand what telehealth is all about. Did you know that there's a telehealth etiquette? So they want to learn about telehealth etiquette, how, you appear, on video, to your patient, just like, we have email etiquette and all of that. So they want to be familiar with that. They want to be familiar with the legal aspects of telehealth. They want to be familiar with, equipment use. Should they be ready, in terms of, getting the malpractice insurance that covers telehealth across multi-states and all of those. If APRN is practicing across multiple state lines, ensure that malpractice insurance extends coverage to multiple states. It is something that, as providers, we do not think about. We just get excited that, oh, wow, I'm going to practice in so many different, settings across the states. But you want to make sure that that is in the umbrella of coverage so that it covers you. You want to be familiar with federal and state laws regarding telehealth. And also, I would recommend that if that new nurse practitioner has not had an opportunity to shadow an experienced nurse practitioner that has done telehealth, that they should grab at the opportunity to be able to do that. So those are some of the advice I will give to new NPs.
That's some great advice. What other legal implications for nurse practitioners using telehealth?
So the very first thing that, we think about, number one, is patient privacy. Patient privacy and data security, which kind of falls in lines, with HIPAA. HIPAA, of course, is very big. So that's something that it's federal and also, state. and that wherever that we practice, because there are so many practice settings, and sometimes as clinicians and as nurse practitioners, when we have an opportunity to have a job, we're not really thinking about all those dynamics, that you want to be able to ask those questions, to your employer, are this equipment that I'm using, are they HIPAA secure? Are the security, secure in terms of, the patient, before you embark on anything that's going to compromise your relationship, one, with the patient, and then also, bring legal ramifications, to you. The good news is the waiver 1135 that was drafted, by Congress, right when, the COVID pandemic, broke, to allow for, telehealth, to come into place, kind of, relaxed some of the HIPAA regulations. Isn't that amazing?
Yeah.
Now, the question is, how long is that going to last? All of that falls apart pretty much when the COVID pandemic is announced as being over.
Wow.
So, yeah, and it is actually a point that as a lot of us providers are not aware of. So when the pandemic is declared over, most of these relaxations will go away. It will not be as relaxed as it is. So what do we do? Right now in Congress, there is under federal bill tracker. So if you go under www.gov tracker.gov, or just type in, federal bill tracker, you should be able to, pull that up and just type in telehealth. There are about 6 different bills waiting that's going to help to modernize telehealth and go beyond waiver 1135. So this is very crucial, that we call our senators, we call our congressmen, and be able to tell them that telehealth needs to stay here, and that, reimbursement, the current reimbursement, and some of the waivers that they currently have in place should be able to stay in place to allow telehealth to continue to thrive.
Thank you. That's some good information. I didn't even know that. So thank you so much. So where do you see telehealth in the next 5 years?
Wow, I just see that, it's just going to, explode exponentially as digitalization and electronics and technology evolves, which has been a pattern, really with telehealth. When smartphones, came on board, when Skype and all of those things, telehealth, of course, started to figure itself, into the medium, for everybody. So I believe that, as technology grows, that, telehealth is just going to, the sky is going to really be the limit. And what does that mean, for APRNs? More job opportunities. There's going to be, more avenues, more platforms, to use. There's also going to be, other specialties that are also going to be available, for APRNs, including informatics, which most of us have not thought about, specializing in informatics, so that we're able to be at the forefront to help our peers as they use telehealth to advance, into the future. So there's going to be growth in the APRN workforce in all settings, and there are 3 significant areas of telehealth right now during the pandemic that the CMS plans to monitor in the future. So we do want to make sure, because these are some of the things that can affect also the waiver 1135. They're going to audit, safety in the use of telehealth. Are we really using that, safely? They're going to look at payment rates. What was it, an overpayment? Was it an underpayment? And all of that is going to guide what happens in the next 5 years in terms of reimbursement as well, in terms of telehealth. And then also, is there any fraud that is involved in all of this? And some of these bills are actually sitting right there in Congress. Some have gone through the House of Representatives, and they're currently, sitting at the Senate, waiting for a vote, into law. So I encourage all of our viewers to be able to go to federalbilltracker.gov and be able to access those, anything related to telehealth, and see what you can do to keep telehealth alive and to improve telehealth for the future for both provider and patient.
Well, thank you so much, Catherine, for that information. I've learned a lot just by listening to you. So thank you so much. And I'm sure the viewers will learn a lot as well. So to my viewers, please like, subscribe, and leave any comments below. And thank you guys so much. And we'll see you next time. Bye-bye.